I'm Austin Tucker.
Faith Robbins.
This is our skill. Okay.
We're ready?
Yeah, we're ready.
Okay. Guys, I just got here, just arrived on scene. I'm gonna work on this one right here. Seems to be a little more serious than this one. You got one more patient over here,
Right.
about mid-30s, something like that. I will not have time to check them out.
All right.
Take care of it for me.
Yes, sir.
Appreciate it.
Yeah, thank you. All right, so we are taking appropriate BSI standard precautions to begin. Right away, I can tell our patient is awake, he is breathing, he does have a pulse. We do notice an arterial bleed on the right lower leg. So this time we're gonna get more standard precaution, we're gonna get a little more appropriate PPE. Okay, at this point, I am dressed in PPE now, so I'm okay to touch the patient. So immediately we're going to take our 4x4s and we're going to try to stop the bleeding by direct pressure. Does that work?
Still bleeding.
Okay, so at this point we're going to put on some more dressing and see if that works. Does that work?
The wound is still continuing to bleed.
Okay, so at this point she is going to grab a tourniquet and apply the tourniquet, and I'm going to hold this and I'm going to make it a pressure dressing just to hold it in place.
We're gonna go high and tight with the tourniquet,
Following our local protocols
making sure to cut off the artery.
in the appropriate place and getting the appropriate artery to be cut off. I'm wrapping this to make it a pressure dressing, making sure that it is stable. She's applying the tourniquet, like she said, high and tight. That is our local protocols here, not low. Okay, so she is done with that. You want to assess the distal pulse? Okay,
Okay, I'm gonna assess distal pulse.
do we have distal pulse?
There is no distal pulse.
Is the wound still bleeding?
The wound has stopped bleeding.
Okay. Is our patient showing signs of shock?
The bleeding is controlled and the patient is in compensatory shock.
Okay, so since he is in compensatory shock, we're gonna grab a blanket and we're gonna cover him up.
To prevent the heat loss from the body.
At this point, we're gonna begin our primary assessment. So, sir, can you tell me what happened today?
I was driving through an intersection, I had a green light, and another vehicle hit me on the driver's side.
Okay, so by him speaking, we know he has a patent airway. He is breathing, he does have circulation, so we know he's okay there. He's responsive. So at this point, we know his airway's good, so we're gonna go ahead and administer oxygen at 15 liters per minute as treating the shock. And at this point, I'm gonna uncover the patient, listen to breath sounds. Okay, everything sounds good on the breath sounds, but I do notice that he has paradoxal motion or movement, so that would be a flail chest, so we're gonna need a bulky dressing and tape. And then I would also assess the rate of his breathing. And do you have the rate of his breathing?
Respiration is 20.
Okay, and we did go ahead and pre-fill this bag, to fill it out. We just don't want to actually put the patient on oxygen. So we're gonna go ahead and we're gonna put that there.
Hold that for me.
Okay, so we're gonna hold, we're not putting pressure, we're not gonna restrict chest wall movement with this tape. We're just securing it in place and trying to take a little bit of pain out of it and help with his respiration. Okay, I'm gonna go ahead and tape it. Okay, so that's secured down there. Okay, and now I'm going to listen, re-auscultate and see if our breath sounds are improving. Okay, the right side is improving and there's no longer paradoxal motion. We're going to cover him back up. We do have him on oxygen, so that's taking care of breathing. We have assessed there are no further major bleeds, so we're gonna check the condition and color of his skin. Do we have a pulse bilaterally? Okay, and then we're gonna assess capillary refill. Everything looks good. He is showing signs of shock, but we're keeping him covered up, so he should be okay there. At this point, we have a high priority patient that needs immediate transport because he does have that arterial bleed that is stopped and he is showing signs of shock. So at this point, we need to transport him as soon as possible. So now we would go into our secondary assessment. So we need a full vital sign. So I will obtain his blood pressure if you will get his pulse and respiration.
I will count the pulse for 60 seconds, and my pulse rate is,
68.
okay. And I would count his respirations for 60 seconds, which is,
Respirations are 20.
okay.
Okay, bag is in place. I'm gonna also take for his blood pressure. Getting right over the artery, pinching it off. What is my blood pressure?
Blood pressure is 130 over 70.
Okay, so at this point, I'm gonna ask him, sir, are you allergic to anything?
Nothing late?
Okay.
Okay. Do you take any medications?
No.
Okay, have you had any past medical history?
No, foot surgery.
Okay,
What was the last thing you ate?
Lunch.
okay, and then, you said you were driving the car when this all happened?
Yes, sir.
Okay, so at this point, we know that we've obtained his, sample. Now we're gonna move on to, a full body focused exam. So if you wanna start with this, or I'll start with the head, checking for deformities, checking for anything out of the ordinary, checking behind his ears for battle signs, under his eyes for raccoon eyes, checking for cyanosis. He's not cyanotic. We're looking good there. Everything appears to be good.
Okay, we check the cervical spine right here along the neck, checking for deformities, looking at the disposition of the trachea, looking for JVD. At this point, I would put on a C color to maintain C-spine.
Okay, and at this point, I'm gonna reassess our intervention. Intervention still appears to be holding. I'm gonna go ahead and re-auscultate. Okay, everything is still sounding very good.
Okay,
We're
and
gonna move on.
I'm gonna palpate each quadrant of the abdomen, looking for tenderness, guarding, and any rigidity.
Keeping him covered. I'm gonna check for priapism. There's no priapism found. I'm gonna check this, avoiding to just put any pressure on that tourniquet. I'm checking pulse. I still should have no pulse. I do not.
Okay, and I'm checking this leg, looking for any deformities. And I have a distal pulse in this leg.
Okay. So I'm checking this arm for any deformities. I don't find anything. I'm checking pulse. Do I have pulse?
Yes.
That's, pulse.
Okay, and then we'll check this arm again, getting a pulse in
Pulse, yes.
Okay. And I would like to establish that when we did put this tourniquet on, we did go ahead and put the time on it. And so we have the time written down so we know when we applied the tourniquet. Now, at this point, we've completed a full body exam. So what we're gonna do is we would have another assistant come over here and maintain C-spine, and then she would come around here and we would roll this patient in, keeping him in line on the head person count. So 1, 2, 3, he would say roll. We would pull him over on the side. We would assess the buttocks, the lower back, the upper back for any deformities, anything like that. We would not find anything. If we had a backboard, we would slide it under the patient. On the head person count, we would roll the patient back over, making sure to strap them securely. The abdomen first, then we're going to go to the legs per our protocol, then we're going to go head, and then we would assess PMS all over again, which would be no pulse on that leg. Pulse, pulse, pulse. If we have pulse on that, then we'd secure him. Since he is a high priority transport, we're going to transport him as soon as possible. And we would reassess our interventions, which would be the tourniquet and the bulky dressing. We would reassess those, and we would reassess vitals every 5 minutes because it is a high priority patient. And we would give an accurate report to the receiving hospital. Our scene is done.